Good day, Wonder Nurses. I'm Nurse Anne. Our video for today is all about psychiatric nursing. So if you're ready to learn, let's start. What is mental health? According to CDC, mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. While according to WHO, mental health is a state of well-being in which an individual realizes his or her abilities, can cope with the normal stresses of life, can work productively, and can contribute to his or her community. Let's also define the mental disorder. According to WHO, there are many different mental disorders with various presentations. They are generally characterized by a combination of abnormal thoughts, perceptions, emotions, behavior, and relationships with others. Mental disorders include depression, bipolar disorder, schizophrenia and other psychoses, dementia, and developmental disorders, including autism. If you want to learn and review schizophrenia, I have a simple discussion here. You can also check the link in the description below after watching this video. Let's continue. We also have the Diagnostic and Statistical Manual of Mental Disorders. It is the handbook used by healthcare professionals as the authoritative guide to the diagnosis of mental disorders. It contains descriptions, symptoms, and other criteria for diagnosing mental disorders. Hildegard Peplau, Interpersonal Relations Theory. Peplau is a nurse theorist who is also known as the mother of psychiatric nursing. She considers nursing to be a significant, therapeutic, interpersonal process. With regards to her theory, she defines it as a human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help. Peplau theorized that nurse-patient relationships must pass through three phases to be successful. First is the orientation phase. Initially, nurses are expected to greet patients with respect and positive interest. The most important established during this phase is the trust of the patient to the nurse. This can be done by being reliable, available, and consistent. Next is the working phase. In this phase, nurses make assessments about patients to use during teaching and when contributing to the interdisciplinary plan of care. Nurses also use non-directive listening to facilitate patients' increased awareness of their feelings regarding their changing health. Using this form of therapeutic communication, nurses provide reflective and non-judgmental feedback to patients for the sake of helping them clarify their thoughts. The final phase is the termination phase. A major part of this phase occurs when nurses teach patients about symptom management and recovery at home. We also have therapeutic use of self. It is the main tool used by the nurse in psychiatric nursing. Nurses use themselves as a therapeutic tool to establish a therapeutic relationship with the patient. Furthermore, therapeutic use of self requires self-awareness. What is self-awareness? It is the process by which the nurse gains recognition of his or her feelings, beliefs, and attitudes. The goal is to know oneself so that one's values, attitudes, and beliefs are not projected to the patient that can affect or hinder nursing care. One tool that is useful in learning about oneself is the Johari's window. Johari's window has four quadrants. The first quadrant is open or known. These are the qualities that you know and the people around you. Second is the blind or unaware. These are the qualities that you don't know but the people around you recognize. The third quadrant is hidden or private. You are the only one who knew it. Finally is the unknown. It is an empty quadrant for qualities that are not yet discovered by oneself or others. Let's now talk about one of the important topics in psychiatric nursing: therapeutic communication. It is an interpersonal interaction between the nurse and the patient. Theracom is a collection of techniques that prioritize the physical, mental, and emotional well-being of patients. Nurses provide patients with support and information while maintaining a level of professional distance and objectivity. Here are some examples of therapeutic communication techniques. Accepting. It indicates reception. An accepting response indicates that nurse has heard and followed the train of thought. It does not indicate agreement, but is non-judgmental. Broad openings. Allow the patient to take the initiative in introducing the topic. Broad openings make explicit that the patient has the lead in the interaction and may stimulate him or her to take the initiative. Exploring. Delving further into a subject or idea. This can examine the issue more fully, and any concern can be better understood if explored in depth. But if the patient expresses unwillingness, the nurse must respect his or her decision. Summarizing. Organizing and summing up important points. Summarization seeks to bring out the important points of the discussion and to increase the awareness and understanding of both participants. It omits the irrelevant and organizes the pertinent aspects of the interaction. Finally, is presenting reality, indicating what is real. When the patient is misinterpreting reality, the nurse can indicate what is real. The nurse does this by calmly expressing the facts and not by way of arguing or belittling the feelings of the patient. If you want to assess your knowledge about therapeutic communication, try to answer the questions in the link here. It will also be available in the description below. The correct answer and rationale are also provided. Let's continue. Here are also some examples of non-therapeutic communication techniques. First is advising. Telling the patient what to do. Giving advice implies that only the nurse knows what is best for the patient. Next is belittling feelings expressed. Misjudging the degree of the patient's discomfort. When the nurse tries to equate the intense and overwhelming feelings the patient has expressed to everybody or to the nurse's feelings, the nurse implies that the discomfort is temporary, mild, self-limiting, or not very important. Probing. Persistent questioning of the patient. Probing tends to make the patient feel used or invaded. This will not encourage the patient to talk. Moreover, they also have the right not to talk about issues or concerns if they want to. Reassuring. Indicating there is no reason for anxiety or other feelings of discomfort. Implying that there are no sufficient reasons for concern, completely devalue the patient's feelings. Finally, requesting an explanation. Asking the patient to provide reasons for thoughts, feelings, behaviors, or events. Usually, a why question is intimidating. Furthermore, The patient is unlikely to know why or may become defensive trying to explain themselves.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.